First, we'll hear a short review from Jenna.
Thank you, Madam Chair. Good morning, committee. House Bill 2284 directs the Department of Administration to adopt written policies governing the negotiated procurement of managed care organizations, often referred to as MCO, to provide state Medicaid services pursuant to a contract with the Kansas Program of Medical Assistance, which we refer to as Medicaid. Section 1, so this is an all-new section. Section 1B states that such policy shall include a prohibition on the destruction of records and adoption of a tie-break procedure if the evaluation process involves scoring by individuals or committees, and a requirement to be transparent with the legislature during each step of the procurement process. The House Committee added language in subsection B4 to add an appeals process, which would be overseen by an appeals committee. Paragraph 4 sets out the membership of this appeals committee and that the committee shall oversee and adjudicate appeals in accordance with policies adopted by Department of Administration. Section 1C states that the policies shall be adopted and implemented prior to July 1, 2026. This bill would take effect on July 1st after publication of the statute book, and it passed the House on a vote of 120 to 3. And I will be happy to answer questions.
Committee, any questions for Jenna this morning? Seeing none, thank you, Jenna. Our one and only conferee is Representative Will Carpenter. Welcome to committee.
Very good. Thank you, Madam Chair, committee. Good to see all of you again. Many of you I've worked with before. This comes about from our big MCO issue last year with selecting a new managed care organization. It was flawed at best, and there were so many questions. There were documents that had been destroyed. It was a tie. There was no decisive way of deciding who got the tie. It was just so this adds just a ton of transparency, which is what this is all about. Transparency to the process, to the legislature. We're the ones that pay this bill and these bills, and so this just adds not only that, but then we amended in the committee to provide a appeals process, which would be, as you read in the bill, a group of legislators that would decide. Not the courts. It went to court. It was in court for months, and I could go on for a long time, but I won't answer questions, please. Oh, sorry, Madam Chair.
And I know you have to get back to your own committees and your own meetings, but are there any questions for Representative Carpenter? Yes, Senator Petty.
Thank you, Madam Chair, and Representative Carpenter. It's good to see you here. Even though with the selection of the managed care and organizations, and the fact that there was a nonpartisan group that was looking over those applications and evaluating them, and had a procedure for ranking the questions and giving them a score, this would then put in place another layer.
Only for the appeals process. The rest of it will be done, and it instructs the Department of Administration to put together a set of guidelines that is clearly spelled out as to what they will be doing. We had no input in the original Department of Administration deal. There were documents that were destroyed, and we had no proof to go back and even ascertain whether those were true or not, if that's what you're talking about.
Right. I mean, I sit on Can Care Oversight and with you as well. I think there sometimes is a difference of opinion as to whether once this process is in place, and of course this is not something that happens every year, that there doesn't then become, to me, sometimes it seems a little bit of legislative after the fact meddling, of saying that certain things were not followed, where in fact there was a procedure in place, it was followed. And I sat and listened to that. the discussion about should we then, or should someone else then look at the scoring sheets of those on that committee? And this then puts in place that one, no documents are destroyed, but again, that would be somebody looking at scoring sheets that are used by a evaluation group and putting in another layer. So you're saying only another layer if there's a tie or a supposed tie.
Thank you, Senator, for that question. I think two things. One is, yes, in the event of a tie, but the other one is that it does need a level of transparency and oversight from the legislature. It's $4 billion to our state. We pay that bill. We need to be involved in that process to understand. But it's mainly, to me, it's about transparency. When you have questions, you can get answers. And that was probably the biggest thing, I think, for CanCare oversight and for myself, was that it was very difficult. It was not a transparent process.
Thank you.
Additional questions for Representative Carpenter? Having chaired that committee and vice chaired the committee, because we flip on alternate years with the House and the Senate, I remember this being brought up as a recommendation that we should take a look at the process. Lots of discussion, and we can just be open about that, in that there was another MCO in place. And then there was, some consternation. Yes, it ended up in court. We didn't see anything. I would agree with this. I just think an extra layer of oversight from the committee that's supposed to have the oversight particularly, but for the legislature. Thank you so much for being with us today, and I don't believe that we have any other questions. Thank you.
Thank you, folks. Have a great day.
You too. This closes the hearing on 2284, as there were no opponents to this nor any neutral testimony. We're now going to open the hearing on 2249. And Revisor Jenna will give us a quick overview.
Thank you again, Madam Chair. House Bill 2249 requires the Secretary for Aging and Disability Services to grant physical environment waivers for certain rural emergency hospitals to provide skilled nursing facility care. Hopefully this sounds familiar to you all, because it is a mirror of what you passed out a couple weeks ago, which would have been SB 82. It creates a new section of law requiring the Secretary for Aging and Disability Services to grant a physical environment waiver for existing nursing facilities to a rural emergency hospital that applies to transition up to 10 swing beds into skilled nursing facility beds if that facility is currently licensed as a rural emergency hospital, was licensed as a hospital prior to being an emergency hospital, and during its licensure as a hospital, they provided skilled nursing facility services or critical access hospital swing bed services for at least 1 year without a finding of immediate jeopardy, and the bill would go into effect in the statute book July 1. There were no committee amendments and passed the House on a vote of 122-0. I'll be happy to answer questions.
Committee, any questions for Jenna? This should sound very familiar to us. Seeing none, thank you, Jenna. And our conferees can be very brief, since we heard this before, and we can start with Kylie Childs.
Good morning, Madam Chair and members of the committee. My name is Kylie Childs, Director of Government Affairs with Leading Age Kansas, the nonprofit trade association for nonprofit aging services providers. So thank you. We'll keep our remarks brief, but from our perspective on the long-term care side, Representative Bueller shared in House Appropriations earlier a couple weeks ago that there's been a net loss of over 1,700 beds in our long-term care sector. Part of having an adequate healthcare continuum for aging Kansas is to ensure there's not only long-term care facility services, but also shorter-term skilled nursing services. And this bill would help us to be able to do that by maintaining those services in these hospitals that are transitioning that have already been providing them. So we would ask you to support this passage, and I'm happy to stand for questions at the appropriate time.
Thank you, Kylie. And next we have Tara Mays.
Good morning, Madam Chair, members of the committee. I am Tara Mays on behalf of our Kansas Hospital Association. We appreciate the opportunity to appear before you in support of House Bill 2249. I will be very brief. This bill really does help our hospitals that want to keep those skilled nursing facility beds that Ms. Childs talked about while we transition to the rural emergency hospital. This is one important step in the process to both being able to become rural emergency hospitals and innovate and provide services in communities across the state, but keep those skilled nursing facility beds. And Madam Chair, I'm happy to stand for questions at the appropriate time.
Thank you, committee. Are there any questions for the oral proponents? Seeing none, we now have the oral neutral testimony from Lacey Hunter.
Sorry. Looked great. I'm sorry. Good morning, Madam Chair, members of the committee. I'm Lacey Hunter. I am the Commissioner of Survey Certification and Credentialing for KDADS. My testimony is not much different from the previous bill and or times you've heard this before. I believe there was only one change that we really made to our testimony, in that we would have little physical impact on our agency. It does clarify our authority and responsibility to provide waivers. We are aware of only one rural emergency hospital at this time that this bill would have impact on. And it would only impact that facility if the Centers for Medicare and Medicaid Services also allowed them to be certified for Title 18 and Title 19 services. Other than that, it's pretty much the same.
Thank you. Any questions for Lacey, committee? Senator Petty.
Hi, Lacey. Thank you for being here. So they would already have had these long-term beds in place before they wanted to transition. Would that be correct?
Correct. I believe the bill says that they would have to have provided skilled nursing services or have identified swing beds.
Thank you.
Additional questions, committee? Seeing none, thank you so much. This closes the hearing on House Bill 2249. We will open the hearing on 2280, and Jenna will give us a bill brief.
Thank you, Madam Chair. House Bill 2280 clarifies that the authorized activities of paramedics, advanced emergency medical technicians, and emergency medical responders, so that'd be paramedics, AEMTs, EMTs, and EMRs, may be authorized upon the order of a healthcare professional. It permits certain ambulance services to offer service for less than 24 hours per day and requires entities using automated external defibrillators or AEDs to register with the Board of EMS. Section 1 amends KSA 656112, and that adds a definition for an emergency medical responder as well as a qualified healthcare provider. Section 2 amends KSA 656119, and it states that after successfully completing an approved course of instruction, localized specialized device training, and competency evaluation, and after receiving authorization from medical protocols or upon the order of a qualified healthcare provider, a paramedic can perform the authorized activities under, and then it lists those three statutes, and those are the statutes for AEMTs, EMTs, and emergency medical responders. So you can think of the scope of authority of these emergency medical responders as sort of building on each other, that an EMT can do a few things, and then you add on the designation of an AEMT, they can do extra things, and then if you become a paramedic, you can do even more things, so they build upon each other. And prior to the changes in this statute, it would have required a paramedic or EMT, AEMT to maintain direct communication by radio, telephone, or video conference with either that physician or physician assistant in order to do the authorized activities. So you have to remain in contact the entire time in order to perform the scope of your activities. Section 3 amends KSA 656120, and that would be on page 3, and that would be related to advanced emergency medical technicians, and it lists those authorized activities referred to in Section 2. Section 4 amends KSA 656121, and that relates to emergency medical technicians or EMTs, and it has that same language about if they complete the activities and upon the order of a qualified healthcare provider. And then Section 5 amends KSA 6561-29A, and that lists the professionals that shall supervise a student or EMS provider while the EMS provider is engaged in their course of instruction. Section 6 amends KSA 6561-35, and that allows ambulance services that only provide non-emergency transportation. You can think of this as transfers between different facilities to offer services less than 24 hours a day, every day of the year. Section 7 amends KSA 6561-44 and lists the interventions that can be performed that are referred to in Section 2. Section 8 of the bill amends KSA 6561-49A, and it requires persons that purchase, lease, possess, or otherwise control or acquire an automated external defibrillator to register that defibrillator with the Emergency Medical Services Board. And the proponents will be able to speak to you a little more about how that process works. And this bill would take effect on July 1st. After publication of the statute book, there were no committee amendments, and it passed the House on a vote of 119-1. I'll be happy to answer questions.
Committee questions for Jenna? Seeing none, thank you, Jenna. Committee, we have one proponent for this bill, Joseph House. Welcome to committee.
Thank you, Madam Chair, members of the committee. My name is Joseph House. I'm the Executive Director for your Emergency Medical Services Board, which is your state agency responsible for the oversight of EMS in Kansas and all things EMS. Folks, the language before you is very good. The process to get there was even better. So this is a 3-year collaborative work with the industry in order to identify some of the shortcomings and falls where to ensure that the language that is there is something that works within the current practice, and that is also something that they needed as moving forward. And so we're very pleased with the language that came forward in modernizing this bill and coming forward. Just two things that I want to touch upon. I mean, you have my testimony in front of you, but the non-emergency transportation piece, that 24/7 requirement is absolutely necessary. We have problems getting transfers out of facilities, and we have entities that want to start a business. However, being open 24 hours a day is a little bit of a struggle. So they would like the flexibility to have a business model whereby they don't have to provide that non-emergency side of things 24 hours a day, give them the opportunity to run that as their business, adjusting their hours as they need to in order to meet their needs of their clients and such. So that was a great piece that was added within there going forward. The second one I want to draw attention to is the registration of the AEDs. And so currently, I'm a very visual person, so this is the AED placement notification form that is currently filled out and submitted to these ambulance services and asked to be passed on to their communication center. This, in essence, when they start compiling all of this, generates close to 300 different databases worth of where these AEDs are located. The registration process unifies all of that into a singular location, makes it accessible to all. So all ambulance services would have access to it. All communication centers would have access to it. So when you call 911 from within this room, the 911 telecommunicator knows the closest AED is sitting on the elevator wall out here and can direct somebody to say, hey, if it's available, please go get it, and give them a location as to where that's located at. There is an ability within the registration system to say this AED is not available 24 hours a day or not available for public use. It's a checkbox. They check the box. It comes up on the map for the telecommunicator with a hash mark on it that says it has restricted access or restricted use. Also has a method of being able to register a mobile device. So the fact that if it's in the back of a law enforcement vehicle, that it may not necessarily be in the same location. Westar Energy is a great, or I guess now Evergy, sorry, is a great example. They have AEDs located within each of their transmission trucks. However, they're so mobile that they are registered as a device. We just know that they're close in coming forward. So those are the two parts there that I wanted to make sure I elaborate a little bit more upon. We are in strong support of House Bill 2280, and we urge your support. I'm happy to answer any questions at the appropriate time.
Committee, are there questions? Yes, Senator Owens.
Thank you, Madam Chair. question for you on this registration. How many other states do this? Are we lagging behind in this process? I didn't see anything on the fiscal note as far as costs associated with that and who's going to bear the cost. So we'll start with those two, and then I have a follow-up.
So, great questions. Are we lagging behind? There are other states that do a much better job of registering these devices and placing them into that than where we are. We're probably middle of the road in comparison to some of the other states. Cost-wise, it doesn't cost us anything to have this system to build up, so it's just our time in monitoring it, maintaining it. We do ask our ambulance services if they have the capability to go out and physically put eyes on the AED to verify its location, that they please do. However, I have inspectors that are out across the state, and they are directed to do that when they identify those, just to make sure it is showing up within the system.
If I may. Okay, so interesting. So this is a free piece of software that you guys have access to that every 911 dispatch center also has access to?
Correct.
I have never heard of such free software in this building in my life.
We were very pleased to fall upon it. So the application, the mother application that we utilize is PulsePoint AED. So it has a map layer that's built in, and that's integrated into our 911 system.
Very interesting. Final question, again, on the AED. I see that the bill clarifies that only persons or entities that have a registered AED would have civil liability protection. What's the logic behind that? Because if I wanted to buy an AED, I'm concerned about the burden and whether individuals or businesses would know that this exists. How are they going to know that this exists? And if they don't receive the protection if they fail to register. Talk me through that.
All right. So that was actually because there's no real teeth to the notification. It's kind of you fill this out or it's not there. Currently, the suggestion that was made was to include the liability side of that, the civil liability side of that, to say a little bit. We absolutely expect a campaign to go out to say, hey, these need to be known. These need to be registered as we go through. It's more for the public's side of it, the telecommunicator side of it, to ensure that they know where those devices are at. So that what we were advised was linking it into that component was actually the easier way to do that, to say that this does need to be done moving forward. So,
interesting. Okay. Yeah. Thank you very much. Thank you, Madam Chair.
Senator Clifford.
Thank you, Madam Chair. A follow-up to Senator Owens. And I've been in a situation where I wish it had been known where the AED was rather quickly. So I like the idea of registration. But I'm concerned that if I have one in my home and then I have a cookout and somebody codes and I use the AED, I won't have liability protection if I didn't register. So the intrusion into an individual's home is what I have concern about here. Any thoughts about that, or did anyone think that through? I know it's hypothetical.
Right. So the requirements still exist today that they're notified of that location, even if it is within their home, is going forward. And so again, it just the same answer as before. We asked what the easiest way to go about putting this into that language was going to be. This is where we were told it was going to land. So I don't think that we're strong proponents behind the whole linking that to the liability side, but there does need to be something, otherwise we won't know where those are at.
Yeah, thanks for that response. I guess Senator Owens and I may talk this over a little bit and see if we can live with that. But I don't like creating, lawyer feeding frenzies, and these are all tragic situations. And a citizen has a right to have this device in their home. I certainly have them in my clinics. So I get the idea of registration. I just don't like creating a cause of action like this. I appreciate your response, Mr. House. Thank you, Madam Chair.
Thank you. Thank you very much. Committee, I was just shown proof that testimony was submitted by Dave Johnston. He's in the committee room, and so we're going to let him go ahead and testify. Welcome, and sorry for the oversight.
Dave Johnston. I'm with the representing the Kansas EMS Association. My day-to-day job is I'm the EMS chief for Reno County EMS. Joe's done a great job explaining what's gone through with this. I'll just reiterate how collaborative this process was for us. It's not always that you have a regulatory agency and a professional association, the industry coming together. This is something that we've worked over the past 3 years, really dug down over the past year to go through line by line, looking at the EMS statutes and looking for opportunities to improve them. We've labeled this our EMS modernization bill. It's correcting numerous things. We spoke about the physician contact and the way we're contacting them for orders. That's just bringing in line with current practice so the law matches current practice. There are other pieces in here where you'll see that things have changed over the years since the original statutes were introduced. The introduction of an EMT to be able to monitor an IV. Well, most of the time now, patients are being transferred with only a saline lock, and that was not allowed. So it's modernizing several areas in there. I will also concur with Joe on the piece that the addition of the ability for private entities for non-emergency transport is a need, and there's no need for them to be able to operate 24/7. So if they're not subject to 911 call, we would like that ability. In my own agency, we do serve, I work for the Hutchinson Regional Medical Center. We take a lot of transfers, but often we're overwhelmed with 911 calls and we have to call upon those private entities to come in, and it's nice to help offset those transfers. So once again, I'll just reiterate, there is a lot of support behind this. We've rolled this out to all 6 of the EMS councils. Those match similar topography to the Homeland Security regions. We have support from them, support from the Fire Chiefs Association and Marker. So I'll stand for any questions that you might have.
Questions, committee? Seeing none, thank you so much for being with us today. Committee, there are no opponent or neutral testimony on this bill, so this closes the hearing on House Bill 2280. We will now open for final action, House Bill 2170. And Jenna, would you give us a brief?
Thank you, Madam Chair. House Bill 2170 defines or designates the first full week of February as Kansas Burn Awareness Week.
Committee, do I hear a motion on this bill? Senator Clifford?
Madam Chair, I move to pass out House Bill 2170 favorably.
Do I hear a second? Second from Senator Petty. Committee, any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? House Bill 2170 passes out of committee. Committee, we will now open for final action, House Bill 2307. And we'll need a revisor report from Jenna.
Thank you, Madam Chair. House Bill 2307 transfers the power to authorize and oversee those certain activities regarding prenatal and postnatal diagnosed conditions awareness programs from KDHE to the Kansas Council on Developmental Disabilities, and we heard this bill on Thursday.
Any questions, committee? Okay, do I hear a motion? Senator Holscher?
Thank you, Madam Chair. I move we pass out HB 2307 favorably.
Do I have a second? Second, Senator Murphy. Discussion? Seeing no discussion, committee, we will now vote. All in favor of passing out House Bill 2307 favorably, say aye.
Aye.
Opposed, no. This bill has passed. Committee, we are finished with our business for today, and we are adjourned.